Aha, there we go. Well, welcome everyone. My name is Michael Wadowitz, and I am currently the director at AIDS Project Rhode Island. But tonight I'm wearing a little bit of a different hat as a moderator for an event hosted by Thunder Mist Health Center called Hit Us With Your Best Shots. Now, if you're of a certain age, you might know the Pat Benatar reference from the title. And if you're not of a certain age, that's fine too. It works on multiple levels. But this panel tonight is bringing people together to talk about vaccinations and the LGBTQ plus community. I am joined tonight by 4 different panelists who I will ask to introduce themselves in just a moment. But I just wanted to take an opportunity to talk about a couple of things really quickly about why this. Obviously, these days, when people are talking about vaccine, most people are thinking about COVID-19, which obviously is totally fair right now. It's been the hot topic for the last 15 months. But in talking to folks at Thunder Mist as we were putting this together, we really wanted to remind everyone about the other vaccines that are available out there that are really important for people's health, especially in the LGBTQ plus community. So that includes everything from HPV to hepatitis A and B, even flu, and some others. So one of the things I thought was telling as I was putting all of this together over the last few days is that I was reading an article in the New York Times, and the chief nursing officer at Callan Lord Community Health Center in New York City had recently said in that article, quote, "There's an overwhelming mistrust around vaccination," and went on to say regarding talking to his patients, quote, "They are not quick conversations. They are addressing someone's personal experiences and their history of discrimination." Add to that some interesting statistics about the COVID-19 vaccine that the Human Rights Campaign recently published, where they noted that only 29% of Black and 39% of Latinx LGBTQ plus folks they had spoken to planned to get a COVID-19 vaccine, compared to about 50% of white LGBTQ plus individuals. So all of this, of course, hits on a lot of different issues that are compounded around LGBTQ healthcare, access to care, medical mistrust, a history of not getting the most optimal experiences with healthcare providers, and discrimination. So that's part of the reason why we are hosting this tonight. And when you've experienced stigma and discrimination firsthand, obviously you're not necessarily rushing to get in line for a vaccine. And the COVID vaccine in particular has brought a lot of this feeling to the forefront. So we wanted to dive into that a little bit tonight. That's why we put together a great panel with folks from here in Rhode Island who are going to answer some questions and talk a little bit about themselves and what they do. And at any point, if you would like to drop a question into the chat, we can address that as we go through. And we'll have some time at the end to take additional questions as we go. So with that, I'd like to start introducing our panelists, and I will just kind of point to you because I'm sure we're seeing each other in different configurations. But Will, why don't we start with you? Oh, you're muted, Will, sorry.
Amazing how we can still do that, huh? Hi, everyone. I'm excited to be here. My name is Will Giordano Perez. I'm a family medicine doctor and medical director at the Tri-County Health Center, where I started the LGBTQ health program to expand access to HIV, Hep C, and transiform care. I also am on the governor's task force for the COVID-19 vaccine and assistant clinical professor at the Brown Medical School.
Great. And Lee, how about you?
Hi, everyone. My name is Lee Hubbard. I'm a registered nurse. I am the clinical manager at Open Door Health here in Providence, which is Rhode Island's only LGBTQ plus clinic. I am also the president of the American Nurses Association, the Rhode Island chapter. So, and I've participated in several immunization clinics, both here at Open Door and also at the Miriam Hospital, way back when in January. So happy to be here.
Thank you. And Julio?
My name is Julio. I am a research assistant at the Miriam Hospital, and I am also a prevention worker at AIDS Care Ocean State Prevention Center.
And Tim.
Hi, I'm Tim Cavanaugh. I'm a family medicine doctor. I have been working in and around Rhode Island for a long time, and doing LGBT health through most of that time. I actually spearheaded a hepatitis B vaccination program for MSM, both in and out of the bathhouse. Gosh, probably now about 15 or 20 years ago. Ran an HIV and STD testing site in the bathhouse for a while. For the past decade or so, I have had a focus in trans health. I was the medical director for the trans health program at Fenway Health for 5.5 years, and a couple of years ago moved back down to Rhode Island. I'm currently working at Thunder Health Center.
All right, thank you. And I appreciate that everyone has their pronouns in their screen, their little captions. So apologies for not verbalizing them and setting that cue, but you can see them all here on screen. So, I had put together a series of, kind of questions to get us started. So this is kind of a round robin of sorts. And Will, I was just going to start with you, actually, because I know you've been doing a lot of work recently around vaccination with COVID. But, let's just talk about vaccines in general. So obviously there are big differences in the viruses that, cause the different diseases that we're talking about today. But in general, in layperson terms, how do you describe to people how vaccines work to protect us?
Well, that's an awesome question, Michael. Thanks for that one. That's a complex one, actually. But let's see. If I'm talking to one of my patients, how might I talk about this? I would step back first to understand what a pathogen is. So a pathogen could be a bacteria, it could be a virus, it could be a fungus, it could be a parasite. And pathogens kind of are broken up into different parts. And so if let's picture a pathogen being a circle and maybe little spikes. I think a lot of us have seen that cartoon, and the spikes on the outside of it, we'll call those antigens. So antigens are a subpart of a pathogen. So when a pathogen is presented to our body will recognize or create something called an antibody. And it takes a little time to develop that antibody, but the antibody will become specific to that antigen on that pathogen. And in that time that it takes for the body to develop that antibody, you can get sick from that pathogen, right? When you're developing those antibodies. But once that antibody is developed, it's there and it's specific to that antigen. And then it develops what are called kind of memory antibodies, is that your body will always have these antibodies now to remember the antigen on that pathogen. So should your body ever be presented with that pathogen again, those memory antibodies can boost your immune system or work in combination with your immune system to create a more effective response to fight that disease and prevent you from getting ill again. And so that kind of gets into where vaccines play a role. So vaccines, there are several different types of vaccines. Vaccines can include a small portion of that pathogen. Vaccines can include an antigen of that pathogen, or a vaccine can include a blueprint of what the antigen of that pathogen would look like. And that's kind of what we're looking at with the COVID-19 vaccines. It's more of a blueprint of what that antigen looks like. And the idea there is that your body will be exposed to that antigen or what that antigen looks like, and then will be prompted to create an antibody that recognizes that antigen. And so creating that antibody will then protect your body from becoming infected or hurt when it is presented with that pathogen. Does that make sense? So,
yeah, I mean,
okay.
I know I'm giving you a hard task. In 1 minute, can you sum it up? But that totally makes sense that you're basically training the body to have that response. Yeah. Yeah,
and how to respond. So it's as though your body has already seen that pathogen before, so that it can just function a bit faster and boost that immune system, that immune response quite quickly to actually respond and prevent illness. And so the idea of herd immunity is when you get enough people who are vaccinated, and those vaccinated people are very unlikely to become ill with that virus, say, or that bacteria. And so that you can protect those around them who cannot be vaccinated. And so those people who cannot be vaccinated for whatever reason, there are people who are allergic to components in the vaccine, or certain vaccines can't be given to people with cancer or who have immune deficiencies, for instance. You can provide them with some benefit and some protection by simply surrounding them with people who are fully vaccinated. And that way, that virus, if we're talking about COVID-19, doesn't have a way to easily kind of filter through a group because everyone is immune to it already. That makes sense. And that's what that's what we usually talk about when we're talking about herd immunity. We're trying to, if you can get a vaccine, you're not only protecting yourself, but you're protecting those people around you.
Right. Now, Tim, I'm going to jump over to you because I just, I know this is something that you've been, obviously, you know a lot about, you've been working on for a number of years, but in terms of the LGBTQ plus folks, obviously, like as a community, it's well documented that the community has higher rates of certain diseases, is more susceptible to certain things. But so if you had a patient in front of you who's, LGBTQ, what vaccines would you tell them to get and why?
So I'm going to start out talking about MSM because I that's been a big part of my focus in my career, and I think in terms of vaccine specific recommendations, that the clearest recommendations actually are for MSM. So if I had a young male who was having sex with other men, particularly if they were quite sexually active and having frequent casual sex with casual partners, I would say the number one thing that I would want to make sure that they have been vaccinated against is HPV. HPV, we know, HPV is incredibly common. It is the most common sexually transmitted infection. Probably about 80% of us will get, of the general population, will get HPV infection at some point in our lives. And most of us clear the infection. But HPV is an important vector because it probably is a necessary, HPV infection is probably a necessary step in the development of cervical cancer in women and also anal cancer in men. And I think we haven't talked enough about how HPV is related to anal cancer. Men who have sex with men, their rates of anal cancer are about 1 in 1,400. So 1 out of every 1,400 MSM will get anal cancer at some point in their life. That is basically equal to the rates of cervical cancer that we used to see before we started doing pap smears and such a number of years ago. And really what we have right now is that cervical cancer and anal cancer are vaccine preventable diseases, most likely. So HPV vaccine is available. It's actually approved for vaccination in people between 12 years old and 26 years old. Ideally, we would vaccinate everyone before they became sexually active and before anyone got exposed to any strain of HPV. But even if you have been sexually active, even if you actually have been infected with HPV, you've gotten genital warts or anal warts, or you've had some other kind of changes with HPV, the vaccine still is probably worthwhile because it vaccinates against a number of strains, right? I think, the HPV vaccine has been out for about a decade or so, maybe a little bit longer than that. But the marketing campaigns around HPV have mostly focused around cervical cancer. Most of the talk about young men has been around sort of preventing infection of their female partner. I think we really have not done a good job talking about how HPV relates to MSM. And again, the very high risk really of anal cancer. And the HPV vaccine vaccinates against the most common strains of HPV that can induce cancerous changes, and also genital warts. So it helps to protect against genital and anal and warts also. Right. HPV is also involved with oral cancer. So probably about 30% of oral cancers are related to HPV, where HPV is an important factor. And if you have had HPV infection, you're about 30 times more likely to get an anal cancer versus somebody who's never had HPV. So the vaccine may also protect against oral cancer. We don't have to tell us that for sure, but it seems plausible to be true. So HPV vaccine, again, the issue is you want to get people vaccinated before they've been exposed to HPV over and over again. The reason that the vaccine goes up to age 26, recommendation is after 26, the assumption is made that most people have already been exposed to HPV at that age, and so probably not a lot of benefit. But I think there is the CDC says we should have a discussion with our patients, right? You know, what their history has been like, what their sexual practices are like, and HPV vaccine may be reasonable to give people older than that. Getting the insurance to pay for it is another story. The other thing that I would just mention about HPV vaccine is it doesn't treat or alter the course of infection if you have already been infected. So I've actually had older MSM come and ask me for HPV vaccine because they have sort of early changes that might lead to anal cancer, and there is no evidence that the vaccine changed that.
Yeah, I mean, I will just say as an aside really quickly that I'm a little bit older. I'm not 26, but because I believe the age limit was raised recently, even though I knew that the benefits were limited, I went ahead and got it too because I was like, it can't hurt, right? So it's good.
Yeah, definitely will not hurt. Definitely will not hurt. But again, the benefit it depends really on the person, I think.
Right.
And then convincing your insurance company that there's benefit. I also, in terms of vaccines, I was very big at one point in my career at really encouraging all LGBT people to be vaccinated against hepatitis A and hepatitis B. MSM are definitely at higher risk for hepatitis B. There's evidence that women who have sex with women are also at higher risk for hepatitis B. In trans folk, we don't have data to say that, and I think it really, it has to do with sexual behaviors. But there's a good chance that, lots of trans folk are also probably at higher risk for hepatitis B. Hepatitis B now has become a standard vaccine for children. So all kids get vaccinated for hepatitis B. Most kids actually get vaccinated for hepatitis A at this point. So it's become less of an imperative. I do for patients who I know, again, who are more sexually active and who are maybe more likely to get exposed to hepatitis B, I actually check their antibody titer. So Will was talking about antibodies, that you can sort of measure it. If somebody doesn't look like they have levels of antibody in their system, we'll reback there.
Right.
And I think that's sort of down the line for all.
Got it. So Julio, I wanted to ask you, because you kind of come at this from a little bit of a different angle, and I know you are primarily working with younger MSM in your day job, as well as in some of the other activities that you do with HIV and Hep C testing. I'm curious, from the conversations you're having with the young men that you're interacting with, are they talking about vaccinations, or is it just COVID, or can you give you some sense of how that's going?
Yeah. From my perspective, a lot of Black and Latino folks don't even know that there's vaccines for this kind of thing. So that's technically where the conversation starts. And after that, we just kind of talk about the possibilities of them seeking to get those vaccines if it is within their interest, because that's also something that comes down to is if people want to get this vaccine, it's available. But if you want to take it, great. If you don't, well, then let's maybe have some more conversations to see if we can change your mind about that. Because I know that vaccines are helpful for a lot of things. I get it. There's a lot of chemicals that go into it. Ask your doctors. That's why they're there. But going around with all of the information that we have, sometimes it feels like not enough people are asking us about it, but also it's just a matter of fact of advertising it as well. Sometimes us, including myself in the medical world, we don't really advertise the things that we're offering, so sometimes they get lost in paperwork kind of thing. So that's pretty much the thing that I hear the most, is that, oh, I've never heard about this. It's great that it's available, so how do I get it? Or things like that.
Right. And Lee, I guess I would kind of build on that with you too, where it's, since Open Door is LGBTQ plus focused, like how have the conversations been going with your patients around vaccines in general, not just COVID?
Sure. So I'm not muted. Yay, I'm not muted.
Yeah.
The vaccines are certainly a large part of what we do through our primary care work and through our sexual health care work here at Open Door. We do stock those vaccines. And so if we're able to open the door, ask some questions, and have a patient assent to get a vaccine, we can walk to the next room, grab it, and off we go, jabbing away. And so I would agree, there's very rarely harm in vaccination. A lot of times it is, though, just answering those questions, making sure that people who are seeking care feel comfortable, and that we take the time to answer those questions. I loved, Will, the way that you explained what a vaccine is and what it does. I think that we all vaguely remember maybe the jabs that we got as children, or in middle school, or possibly before college. But very few people, I think, really understand the legacy of vaccination, and how it's right up there with penicillin, as far as how it really just revolutionized medicine and health in our communities. So I know that within my own practice and the practice of our providers here, we celebrate that. We make it so that it's as easy as possible to get them. I believe that vaccines are pretty well covered by the health insurances within our state, especially within the exchange plans, which is a large part of our population here. And so it's just breaking down those barriers, answering those questions, and making it so folks can get what they're asking for at the time that they ask it.
Great. This next question, Will, I'm going to kind of toss it to you, but I'll let anyone kind of jump in with how they want to answer. Maybe you can all talk at the same time. But I'm just kind of curious too, just, because you're day in, day out dealing with a pretty high volume of people, like, are you seeing hesitancy amongst LGBTQ patients of yours about vaccination in general, or maybe is it just COVID? What's the kind of takeaway right now?
Yeah, I don't see a ton of hesitancy, actually. And I think that speaks to being a primary care provider. And so, what brought me into family medicine, probably what brought Tim into it, is that idea that you build long relationships with your patients. And you kind of see them through these different stages of their lives, and you build what we call rapport. And so that your patients generally trust you and the advice you give them. And that's how I talk to my patients. I say, I'm your advice guy. I'm here to give you advice based on what I know and understand. But ultimately, it's up to you and what feels right for you. But hit me with whatever questions you have. Let's make sure that you're not making a decision based off of wrong information, or information you were fed from a source that's not really a credible source. But in general, I feel like my LGBTQ patients respond really well to the idea of vaccinations. If anything, they don't remember if they got certain vaccines. So like Hep B is the really common one, like Tim was talking about. And unfortunately, the antibody testing is the titers aren't even that great for that. But usually that one, I actually have the hardest time probably convincing people to get like pneumovax and pneumococcal vaccines later on in their lives for the prevention of pneumonias. And especially regarding COVID-19, if anything, I think I probably have the highest uptake of the COVID-19 vaccine among my LGBTQ patients, which is quite interesting, hearing some data speaking against that. But I also wonder how many of those individuals are established with primary care versus not established with primary care, right?
I think that's a really good point.
I'll certainly second that. I think that when people, when we had the mass vaccination sites, I think that there likely was the rush of people who knew right away that it's what they wanted, and the people who had questions or fears or doubts about the vaccine or about healthcare in general because of prior experiences, need to have those people like you, Will, like you, Tim, like myself, who they can ask those questions to. And so providing safe spaces at Thunder Mist and all of our great clinics and programs like Open Door make it so that we can answer those questions and provide that service in a really safe place.
I would say most of the patients that I've seen who have some hesitancy around the COVID vaccine almost come in with me saying, I'm afraid of it. It came out so quick. We don't really know much about it, but they're really coming in wanting to be talked into it, right? Like they know they should get it. They think it's a good idea, but they just have concerns, and that's where a good discussion with a primary care doctor or primary care provider can be really,
Right. And I think all of you kind of hit on a point, and Will, yours was well taken about family medicine and finding a primary care physician. It's become such it's a pretty daunting prospect sometimes if you're a queer person to find a doctor that's going to be your primary advice guy, question person, like that you're kind of like, oh right, I'm going to ask all these questions. So I think that's part of this too, and we don't have to go too far into that, but it's a really good point that like more people need to be aware of who's available to them. And like Julio, like you were saying, we don't necessarily advertise certain things certain ways to people. So but Will, because I know you have a background in HIV, I was just curious too, that is there any reason why someone who's living with HIV should be hesitant around getting any of these vaccines, or is that in general, is that not an issue?
In general, not an issue today, day and age. And that's mostly because most people living with HIV who are established with primary care do not have CD4 counts that are below 200, so which would give you the diagnosis of AIDS. So that's the primary difference, HIV versus AIDS, is your CD4 count. And so with a CD4 count less than 200, we avoid a few different vaccines while you're in that range. But once we can get you above 200, we can pretty much offer you, and usually do offer you, almost every vaccine that there is out there. Right? I think if anything, persons living with HIV, they jump right to the front of the line in getting really any vaccine, including the annual flu vaccine. The only ones we hold off on with those low CD4 counts, and sometimes with patients with cancer who also are immunosuppressed, and pregnant women, are live vaccines, what we call live vaccines. And those are vaccines that actually have a bit of the germ or the pathogen in it. And in someone who's got a really low immune system, they can actually become mildly infected with that germ. And so that's the reason we hold off on those. That's like your measles, mumps, rubella, and your varicella, which is your chickenpox vaccine. But again, once pregnancy is over, once the CD4 count comes above 200, then we encourage even those vaccines.
So most of the vaccines we're talking about tonight, just in terms of like COVID, Hep A, Hep B, HPV, even flu, those aren't live vaccine?
No, those are not live vaccines. Those are what we call inactivated vaccines. And the COVID vaccines are unique in that they're more kind of that blueprint template, like I mentioned. So it's not even really giving the antigen or putting the antigen into the vaccine. It's really a blueprint of what the antigen looks like. And so there's really no chance of getting COVID-19 from the vaccine, which is really, really important for people to understand. And the same thing goes for all of those other vaccines that are inactivated vaccines, right? It's teaching your body, hey, should you be confronted with this virus in the future, this is how you handle it, right? But you can't actually get the virus from it. And that includes the flu vaccine, right? Unless we're talking about, there is an intranasal flu vaccine, which is a live vaccine. But the injectable flu vaccine is not a live vaccine. It's an inactivated vaccine. So you cannot get flu from your vaccine.
Will, if you don't mind me asking, do you feel like this new mRNA technology, the new tech vaccine, do you feel like that's going to kind of be the way things are done in the future? Or do you feel like this is kind of an isolated event, an isolated type of technology?
You know, that's hard to answer. I'm not an immunologist by any means. What I can say is it's neat that we were able to develop that. And you know, when people are surprised at how quickly we came up with this vaccine, I usually respond by saying, well, COVID-19 is not a smart virus, right? We actually were able to do it pretty quickly because it can't outwit us the way HIV does, for instance. 40 years later, we don't have an HIV vaccine. It's a smart virus, HIV. COVID-19 is not so smart. And we're putting shuttles on planets. I mean, our space exploration, like we're doing some pretty crazy things out there. The idea that we can come up with a vaccine for a not so smart virus in a year's time is not surprising to me. And so I don't know, though, development wise, you know, if the mRNA process, if that's going to be moving forward. I can't really speak to what that's looking like as far as HIV vaccine development. There are several HIV vaccines in development and that are in studies. And I do believe we will have one day, probably in my lifetime, I believe. But as far as what role the mRNA is going to be, I'm not sure.
Yeah, I think what I have heard, sort of the scuttle, and I'm not an immunologist either, but actually I think the mRNA vaccines, because this is such a completely new technology, the vaccine can actually be, as we've seen, be sort of developed and manufactured relatively quickly. The other thing with the mRNA vaccines is it's pretty easy to tweak the vaccine. Like if a virus sort of mutates, it's actually relatively easy to tweak the vaccine to kind of cover mutations. So the talk that I've been hearing amongst the folks I know who work in HIV is that they're really excited about the prospect of maybe using mRNA technology to develop an HIV vaccine. Although, you know, we're at the very beginning of that, right? It's just sort of a dream at this point.
Right. Tim, just because I know you've done a lot of work with trans patients, and I know there have been some things that have come up recently, specifically around the COVID vaccine. But the first question I had, that, I mean, any of you obviously have worked with trans folks, feel free to answer. But is there any data about interaction with hormone therapy and COVID-19 or any other vaccines that you know of?
So we, I would say a couple things here. I mean, we definitely know that hormones affect, women and people and other people with estrogen in their systems, and men and other people with testosterone in their systems do tend to respond differently to vaccines when they do study that. I'm not aware of any studies that have been done specifically on trans identified people. That being said, the doses of vaccine that are given are meant to kind of create immunity in large populations. Like the study populations include people of different genders, and the vaccines are meant to kind of create a good level of immunity in a general population. So there's no reason to expect that somebody on hormone therapy with estrogen or hormone therapy with testosterone would necessarily respond differently to the vaccine. Certainly nothing that I know of that has sort of addressed the COVID vaccine in that regard. But there's absolutely no. But there's also no reason to expect that it would be different.
Mm-hmm. Agreed. Absolutely.
On that same note, I know just anecdotally, and there have been some stories that have been published about what seem to be side effects for individuals who have periods, experiencing like heavier periods or abnormal periods, which obviously for some trans men, for example, that can be really alarming or, cause certain issues that they want to take care of. Have you had anyone coming to you with those kinds of concerns?
I haven't had anyone come. I've sort of heard, the online sort of stuff of, murmuring about this, and I've kind of gone out and sort of looked at some of the stuff. Right now, it seems to be a social media phenomenon. People on social media talking about the menstrual changes. There are people who have talked about, so cis women talking about their periods kind of coming early, or abnormal spotting, or heavier periods. And I know of one transmasculine individual who reported that they started bleeding, still on their testosterone, still taking testosterone, and started bleeding after getting the COVID-19 vaccine. I think right now we don't know if that is an actual side effect of the vaccine or not. The infectious disease folks that I have read comments by have said, yeah, I mean, certainly sure, it's possible that it could be. Again, vaccines affect the immune system. The immune system is related to our hormonal sort of function. So certainly it could be a side effect. It doesn't look like anything that would cause a permanent change in menstrual cycling or genital bleeding. If anything, it may cause some very temporary disruption. But it needs to be investigated. And in fact, there's a website, somebody at, I can't remember the name of the physician, but somebody at University of Illinois actually has created a website where people can go and sort of talk about their experiences around this, and they're going to sort of accumulate that data and look at that data and see if there's anything to this, and then maybe kind of create a study around. But right now it looks like, yes, potentially it could be a side effect. I will probably start to talk. I haven't had the conversation yet, but we'll probably start to talk about that with my transmasculine patients, that this could happen. But again, really looks like something very.
Got it.
Yeah, I would agree. I think one thing to ask and to take into account here is all the confounding factors that are involved that can that can change your hormone levels and your stress levels and stress hormone levels in your body that definitely affect menstruation in particular, surrounding this pandemic altogether. But then also, I think what's going to be really helpful is when we do look at this data, is it clinically significant, right? So there's something can be clinically significant, it could be statistically significant, and it can be just insignificant altogether. And so what's tricky though is with social media the way it is, it doesn't take much to set off a cascade. And so anything's possible. If my patient says that that's what they're experiencing, I believe them that that's what they're experiencing. And then the conversation goes to, this is not dangerous, right? And that our body responds to the environment, it responds to things, everyone is different, and it responds to things in many different ways. And it makes lots of noises and lots of things change and move, and not all of them are important or matter very much. So let's talk through kind of what's worrying you about it and tackle that. But
yeah, I think actually that kind of leads into it, Julio, what I was going to ask you about, just because I know you're talking to a lot of people about, a biomedical thing like PrEP, for example, which is like you're trying to, tell people about a pill or a medication that you take it every day, which we all know is its own ball of wax. So, not to get too far into that, but I'm curious, like, just because of the way that I know you interact with folks, if networks of friends or people that are already peers talking to each other about vaccination is helpful because it helps calm people down or gives them more information, or if it makes them kind of go into a WebMD, spiral.
Yes, I mean, from my own experience, I have noticed that my friends are more likely to follow something in terms of their health after they probably have consulted with me, since they know that they have, since they know that I work in this and that I am very knowledgeable about a lot of the different things, especially in the regards of HIV. I feel like if this was an approach that were to be taken with, like with the HPV vaccination campaigns that may be happening, I think that will be a great idea, because people love hearing about tips and tricks from people that they know. Instead of hearing it from, let's say, a medical provider that we may not know because they're not our actual medical provider. So It may be more, if I hear something about, let's say, PrEP, and I hear it from someone that I'm like, I don't know if I can trust your information about it, I will be going to my friend and be like, so have you heard about this, by the way? And if the conversation will roll from there. I feel like it's an effective thing. It's just in terms of educating folks. We shouldn't go with the mentality of like, oh, X, Y, and Z person can go out there and do this. We should just teach everybody about it and have everybody just go and do it.
I'd love to piggyback off of what Julio said, because it's great and wonderful when these large personalities and these, large scale influencers recommend vaccines. But what really make my cup runneth over is when my friend who uses mass transit tells everyone on her bus line to come to Open Door for their COVID vaccine. And then we start getting people who say that that's their referral source. I feel like that's what is amazing about this community. And when we're able to build trust and then have our patients refer to us, then we already have a leg up, because there's already a level of trust, because so-and-so said that I could trust you. And then if we can bring that person into primary care, if they don't have one, or get them hooked in with health insurance and other vaccines and PrEP, it's like, it's an amazing day when that's how things go.
Yeah. And it's not so much on just like PrEP and vaccines. It's also when it comes to testing. I could now begin to tell you how many of my friends have gotten tested for HIV for the first time, just because I have been working at AIDS Care Ocean State and I have been able to test. Like, it's just crazy to me when I ask them, have you ever got an HIV test? And they're like, this is my first time. And it's just like, whoa. So, and then we engage in the conversation like, so why were you incited into coming here? And then they tell me, well, one, you work here, and two, I feel like it was time. So the more someone talks about something, the more people will be more inclined into, let's say, doing it at this point, because we are talking about doing something. It is important to have friends like that, I feel. And if you don't have friends like that, that's fine. You will find one at some point in your lifetime.
Well, I mean, and talk about social media, right? Like, even if you're not friends in real life, you are probably friends online. And just as a personal aside, because of working at AIDS Project Rhode Island, I see with our prevention team who do testing as well that, we're getting a lot of questions from people that are not about HIV tests. And so it is this opportunity to kind of, you feel this responsibility to give people the right information and make sure you're directing them to the right resources, and that, they're going to be taken care of the way they want to be or should be. So that is kind of a big responsibility. So I think, Julio, you're right. We're gonna arm you with all kinds of vaccines. But,
no, because then I'm gonna have to get trained to actually administrate them.
Mm-hmm.
Okay.
I can help you with that.
Thank you.
Lee, I wanted to ask you if, like, in the patients that you're dealing with, if you're finding any surprises from conversations about vaccination with them. Like, is anything kind of taking you aback? Like, wait, where is that information coming from?
I'll talk first about COVID specifically. I think that the questions that come up most often are related to maybe a suspicion around big pharma or speed. We've covered that already. Mm-hmm. Side effects are a big thing. Patients are very, very knowledgeable about, I've been hearing and I've read that headaches are a thing. I already get headaches. Am I going to get worse headaches? What should I be prepared for? And so it's really doing a lot of reassuring and, not sugarcoating it, because, 30% of people who do get their second Moderna vaccine in the trial had some sort of robust immune response, but really taking the time to explain what's happening, that it's not a scary thing, that it's not hurting or harming. It's a somewhat natural reaction to this army building that's happening within your body. I would say with other vaccines like hepatitis B, HPV, even like pertussis. Patients don't necessarily remember that vaccines exist for all of those things until there's a life event, right? So we get patients come in and say, there's going to be a new infant in my life, and I've been told I need to get a pertussis booster. And so it's taking all of those opportunities to say, okay, well, while we're doing that, have you gotten hepatitis B yet? And kind of going through those things, meningococcal, flu. Those aren't really the sexy ones, though. I agree with you, Will. My spouse got an opportunity to do a job in a hospital, and he couldn't find his vaccination records, and so he went and had his titers drawn, and he somehow made it to the ripe old age of 40 without hepatitis B vaccination. And so we were able to get him in, and like he's now started his hepatitis B series. And so it's just, I think for some folks, it just isn't on the radar because we don't advertise it. And so I think those are the things that surprise me, or just the fact that folks don't really remember them the way that we all do.
Yeah, and I would say that hesitancy, it's definitely, now we're seeing a lot more hesitancy, especially regarding the COVID-19 vaccine. Our clinic, our health center does about 1,000 vaccines a week for COVID-19. And at the beginning, we had huge wait lists, right? Huge wait lists. And last week was the first week we actually moved to just all walk-in because we had so many available slots and appointments. We actually put several of our staff and nurses in big inflatable hazmat costumes with signs on the street and at bus stops saying walk-in vaccines, Moderna vaccine, come now, get your vaccine. Whatever we can do to get out there and let people know that we've literally dropped every possible barrier that there might be for you to get this vaccine. We're bringing it to you. We're telling you, you don't need an appointment. You don't have to go online. You don't need a phone, access to the internet. We'll get it for you. And there's still a decent amount. I think it's because the people who really wanted it and had done all of their planning and signed up ahead of time, they're vaccinated now. And now we're down to the group that was never that sure that they wanted it in the first place. And I think one thing that's working against us a bit, and we talk about this on our vaccine subcommittee quite a bit, is we've done a great job. We're like number 3 in the country for having vaccinated the largest percentage of our 65 plus population. More than 80% are fully vaccinated in our state. And that was a big driving factor for a lot of our younger people, right? They were understanding that should they get COVID-19, it's probably not going to have that huge of an impact on them. It's more the people around them, their grandparents or the older folk around them. But now that we've done such a good job vaccinating the older folk, we've got some of our young patients who are like, well, looks like I don't need to get vaccinated anymore because it looks like we've protected the people who would get most sick. And so a lot of what we're doing right now is tackling that. And really letting people know that, we have not vaccinated everybody. And there's still about 20% of our older population that is unvaccinated for XYZ reasons. And those people are at the highest risk of getting really sick and hospitalized and dying of this virus. And so, what we can do, even if you may not be at risk of getting really ill yourself, the best thing we can do is kind of protect those people around us who can't be protected. And so that's where we're putting a lot of our effort into right now, is that hesitancy, which we're seeing just kind of move on up as we're getting closer and closer to closing the gap between where we are in herd immunity for the state.
But also the concern, though, because I agree with Will that it's the younger population. Those are the folks we need reaching out to, right? And it really, I think, for them is really about don't be a petri dish, right? Don't be a place where the vaccine can be changing and evolving and mutating, so that your grandparents and all those other people who've gotten vaccinated won't be, right? And the vaccine is no vaccine is 100% effective, right? So there is still a chance that you could infect you could infect a loved one who has been vaccinated. Hopefully, we probably would keep them from ending up in the hospital, but that doesn't mean that they get sick, right? And just, this is, I think we've lost, and because it's become so politicized, right? We've lost that sort of, this really is about community, right? And really kind of creating good community, not just about protecting individual people.
Right. We've had, and Julio, maybe you've encountered this too, just because you don't work in a traditional clinic setting. But at APRI, we've had people who've come in for HIV testing or Hep C testing, wanting to know if we had the vaccine right there and then. And so it does feel like maybe there is this opportunity to meet the need for some of these people who you're not, necessarily seeing in other venues by branching out of certain settings. I don't know, Julio, have you had people ask you about that?
Yes, I have people ask me many things. But when it comes to the vaccinations, yes, I have people ask me, "Oh, is it available like in that?" We have a little fridge where we keep some stuff. Is it in that fridge? I was like, no. If I had it on that fridge, I would not be wearing what I'm wearing. First of all, but also it sometimes for places like ACOS and APRI, sometimes people have the misunderstanding that we are doing things that are allowed to be done like in a setting like that. We are not allowed to do like any sort of blood testing and things like that. Like, we are able to give you a finger prick. That's about it. But sometimes we giving them the resources that they need in order to get to where they need to go, in order to get those medications, vaccines, etc. That's technically what we're there to do.
Right. And I know that the Department of Health has been reaching out to certain organizations about doing some partnership or endeavoring to do some kind of partnerships like that. So community-based organizations could offer at least COVID vaccines. But this is kind of a left field question, but it's just because I used to live in California and there was a big outbreak of meningitis there among men who had sex with men. And so there was this huge kind of quick panic about getting people vaccinated for meningitis. And it doesn't seem to have been something that I've seen in my time here, but I'm just wondering, amongst any of the providers, is it something that you recommend to MSM or men who have sex with men, or is it just not a concern?
We have it in our fridge. I'll have anyone with it.
So I think it depends, right? First of all, meningitis vaccine is one of all of those vaccines that we do recommend for HIV positive folks, right? Because we certainly see higher rates of meningitis and meningococcal infection in those patients. For people who are not HIV infected, I would say, I don't recommend meningitis vaccine unless there's a known outbreak. What happened several years ago, even in this area, Michael, is that we saw sort of these outbreaks of meningitis that seemed to be actually sort of kind of centered on MSM, particularly MSM who were using public sex spaces, right? So bathhouses. And so we actually, I was at Fenway at the time, we very much kind of reached out to folks and any patient who came in who might have been traveling to New York, because New York was one of the sites of the outbreak, traveling to New York or going to bathhouses, even the bathhouse here, because there are a lot of folks who come up from New York and sort of use the bathhouses, people who are hooking up in clubs a lot. Those people, we absolutely recommended that they get the meningitis vaccine. Again, meningitis is one of those things that kids and adolescents now get as a routine thing. So we may not need to worry about it as much. But there are two types of meningitis vaccine also, right? And there's meningitis B vaccine that probably should be offered to people who are going to be like living in dormitories, people who are going to be in the military living in barracks, And also, I think, again, during outbreaks. So meningitis isn't something that everyone needs as a routine thing, but certainly we need to be paying attention to what's going on in the country.
Got it. Well, we have a few minutes left, and instead of me just dictating what everyone should answer, I was wondering if there's anything that each of you wanted to make sure that people knew about this topic in general that maybe we haven't touched on, or any final thoughts. Feel free.
I would touch on one thing. It has to do with the COVID vaccine. It has to do with the Johnson & Johnson's vaccine and these like scary kind of blood clotting things that happen, right? And it's sort of, to me, it was sort of funny because I think with any other vaccine, that would have just been something reported in the medical journals, and of course would have been investigated, and it wouldn't have gotten so much media play as it did with COVID. I think what the things I've been saying to people is the fact that we're hearing about this and hearing so much about it in the media is because we're paying so much attention to safety with these vaccines. It's a good thing that we're hearing about this, right? I do worry that people will be scared away from getting any COVID vaccine because of it. The reality is that it is a really rare occurrence. It's only been seen with the Johnson & Johnson's vaccine, not with the Pfizer or the Moderna vaccine. It's like one or two people in a million who have had this complication. Your risk of having the same kind of scary blood clotting problem with infection from COVID vaccine is like 10 times higher, actually. So it still makes sense to get vaccinated. But I would also say that those blood clotting problems were seen in women, and particularly younger women. So I'm actually telling my transplant patients who are taking on estrogen and increases the risk of clotting disorders. I'm telling them, if you had no other choice but Johnson & Johnson vaccine, you should get it. But if you do have a choice, I would actually take the Moderna or the Pfizer vaccine rather than the.
Got it.
Yeah, that's a great point, Tim. And because when you actually separate that out, those 7 cases of blood clots, and you say that they were all in women under 50 years old, the numbers actually come out to 1 in 80,000 had a blood clot for women under the age of 50. And so, the state fortunately doesn't have very much in the way of Johnson & Johnson vaccine anyways right now. I think the last I knew there was a supply of about 6,500, and the state's only getting about 700 doses a week. But we have enough doses of Moderna and Pfizer to vaccinate everyone who wants it in the state. And so I think that it is really important to remind patients that we have 2 vaccines that are not associated with blood clots. Rather than, I think, putting too much energy into convincing people that Johnson & Johnson is safe, I think we kind of lose track, and we might lose momentum in actually vaccinating as many people as possible with the vaccine that we don't have that risk with. The only other thing I would say, Michael, to everyone is, here you've got 3 primary care clinics represented, right? Mm-hmm. I think this speaks to this state of Rhode Island. There are a lot of options for care. And if you're LGBTQIA identifying, there are a lot of places where you can go. And there's really very little reason to not have a primary care provider. Really, I would say no reason to not have a primary care provider, because all of us who are represented on this panel also see patients regardless of their ability to pay, regardless of how they identify, and really go above and beyond in creating safe, affirming environments for everyone. And so I think that's really important to underscore, because we're lucky in this state to have access, so much access. There are definitely parts of the state where we lack that. And even though we're not a big state, driving 10 or 15 minutes can be prohibitive for some people, based on their circumstances. But I guess I just want to underscore that there's a lot of resources, a lot of access to care here. And so I would really encourage people who don't have primary care set up to absolutely do that.
Yeah, I appreciate you mentioning that.
Yeah.
Lee, Julio, do you have any parting thoughts? Oh, Lee, you're muted.
I almost made it through. I would just say that, sexual health care, primary health care, vaccines, all of that really is just good care. and finding a medical home where you can receive all of those things is just an important life step to take. And Will, thank you for just reminding everyone there are lots of places still accepting new patients who would love to be that home for you.
Julio, anything you want to say, or are you good?
I will say to everyone to get tested regularly because it's important. The summer's coming. There's something that I have started saying after reading an article is that this will be a hot, bad summer. So for my vaccinated folks, remember that the vaccine doesn't cure you or antidote you from any of the other stuff that's out there. So be sure to do your regular checkups at your nearby clinics. So
good reminder. Thank you. And when you do if you get testing done at a community-based organization like AIDS Care Ocean State or APRI, like we have referrals to all the vaccines and people you want to know. So, all right. Well, I wanted to say thank you to everyone. All of you are so awesome, and I'm so happy you could be here tonight. And thank you again to Thundermist for making this happen to begin with. This will be up online for people to see. So, make sure that you let folks know about it if they weren't able to make it tonight. And yeah, stay safe out there and make sure you find out more about vaccines and get them. All right. Have a good night.